Okay, so I'll see if I can share the screen.
Fantastic. So Jan's from the Metanoia Institute, and she's going to talk to us about exploring integrating mindfulness, Chinese calligraphy, enhanced therapy as a complementary psychotherapy to bridge underrepresented Chinese clients in the UK.
Yeah. Can you all see the screen?
Yes, we can.
Okay. Okay. Is that okay if I just
do make a start? Yeah, but we're trying as much as we can to time so we don't go past midnight.
Okay. Okay, well, thank you so much. First of all, Wendy Vout, have I pronounced it right? And it's honor to be here. So I have a presentation and welcome questions in end. Feel free to ask any questions. So my name's Juan Du, and so I'm a trainee, last year trainee in the doctoral program on counseling psychology and psychotherapy. So this talk is about exploring Chinese calligraphy enhanced therapy as a potentially culturally sensitive therapeutic approach for the Chinese community in the UK. So this is a very new approach, and I hope you enjoy it. And I also welcome feedback in the end. Oops. So first, a little bit about myself. I grew up in China, where I practiced calligraphy as a part of national curriculum. Children practice between age 7 to probably 14 or onwards. So it's very much, if you're grown up in the UK, it's a bit like a football to the kids in the school. So even you're not very, you're not calligraphy master, but you know what it's about. You know how to use calligraphy. So it's a part of everyday activities. Being an immigrant, I experienced mental health challenges in the last 10 years. I'm currently a psychotherapist in private practice, also mindfulness teacher in NHS in the UK, and yeah. And so the clinical problems, when I work in NHS, I notice I work in both primary care and secondary care. For those of you who understand the NHS National Health System, is primary care in the mental health service, mainly it's IAPT service is people who experience depression, anxiety. For secondary care, people experience diagnosis, maybe psychosis, schizophrenia, personality disorder, etc. So my own experience working in NHS for 5 years, I rarely see any Chinese people access to mental health services. And so that's get me really interested, because the trust I work in the South is not the I would say not heavily dense Chinese community, but it's quite fair amount of Chinese population, particularly student population. And so, I did some research, and it was research suggests in 2003, Chinese communities are invisible population in the public mental health services. And I did some research with psychologists around the country, and the feedback is very similar. People who psychologists who work within the barrow, which is heavily Chinese communities, say the same thing. They rarely see any Chinese communities access to mental health services, while the literature, on the other hand, suggests the Asian population have higher prevalence of mental health problems, particularly on the immigration, people who first generation of immigrants. So there's many literature suggests that why there's a barrier for Chinese community access to mental health services. Many the service provide in the mental health service, for example, IAPT, and the service are not meet clients' social, cultural, and linguistic needs, and also clients' language barrier and the lack of a mental health services, and then how and the culture, for example, shame, impact on the access to mental health services. As some also suggest that they perceive discrimination from professionals. So for design calligraphy enhanced therapy, the inspiration behind my own 5 years of doctor training and understanding the theories in psychotherapy and in clinical practice, and also my own personal therapy experiences. I had CBT, integrative, body dynamic, psychoanalytical. So it was very interesting for me to personal experience all the therapeutic approach, which is very much a Western centered approach. So, and then also inspired my current work with Chinese clients in my private practice. And then my role as mindfulness teacher for the NHS Trust, and I work with in a different, I don't know if you guys know, it's for example, in a recovery college is where we're social psychoeducational program will encourage clients who experience mental health problems to come into instead of psychological treatment, but it's more so a much more holistic program. And also my motivation to bridge the Chinese community, increase their access to psychological services. So what is the Chinese calligraphy handwriting? So this is a very traditional, the 4 traditional treasures. On this picture, in this picture, you see the paper is a rice paper. And this traditional brush. So this is a Chinese calligraphy brush. You can see from the picture. So the tip of the brush, it can be animal fur or synthetic fur, and the body can be made of bamboo or wood stick. And you traditionally use inkstone, add water to generate ink. That's how, when I developed this approach, I use the traditional method as well. So clients will grind ink for themselves by adding the water. So the whole process is slowed down. So the clients come to the room. Instead of it's a mindfulness practice, I have a grinding ink, prepare the set. So this is compare this brush and normal pen, let's say. This probably you write like 20 words in a minute, something. And this probably write 2 words. So the slow down process is very important in this approach. So when used this approach is very much a body and mind integration. So the maneuver from the wrist and to the arms, so that client is moving their body instead of just sitting. There's lots of literature on calligraphy, handwriting, and mainly conducted in Asia. Literature suggests that calligraphy enhance this kind of handwriting help people enhance their cognitive abilities, particularly for people with dementia, improve executive function and working memories for university students in that population, and the research on people experience depression and cancer patients on use calligraphy practice to reduce their hyperarousal and depressive symptoms. The major gap is, there's many gaps. One of the major gaps is most calligraphy in handwriting is based on Asia and focus on the positive quantitative paradigm, and very few use quantitative method. And also most of the study they said about the client or the participant practice calligraphy, it didn't say what do they practice, actually how long do they practice per day. So it's very vague. Although the clinical problem I addressed earlier has been recognized for 20 years, and there's no actual study attempt to bridge in the gap. So this is a very much new concept. So the treatment rationale for this is as a calligraphy handwriting as a culturally sensitive and non-threatening approach, and as a creative approach in working with a client who experience mental health problems. And in develop this approach, I integrate cognitive theory and mindfulness theory and psychodynamic theory. The therapy I developed is 4-session protocol, but it's a very loose protocol. Therapists can adjust, make into longer session or short sessions, depend on the client's needs. The idea behind is a meaning bridge through the calligraphy characters and the familiarity of calligraphy mindfulness experiences, access to their problematic experience, and turn them to resources. So there's some significant features of calligraphy enhanced therapy compared to a talking therapy. One is the mindful breathing. So breathing is a very important part of the practice. So clients come to a session before the therapist with the client will do some grounding breathing together. And then we'll come with grounding ink preparation for the calligraphy writing process. Both clients and therapists prepare their own calligraphy set as spontaneously. And in this approach, I promote implicit equality, where normally talking therapy, particularly is in a psychoanalytic approach, client is the one needs help, therapist the one is the expert. So in this approach is both the implicit equalities, both client and therapy use the same approach, and the therapist use calligraphy taking notes rather than normal notes. So therapists, it will encourage a client to use calligraphy to write down their thinking and thoughts come to their mind. This is a particularly paramount for the Chinese culture, because in the culture is promoted positive thinking. So things they feel shame, it's difficult to verbalizing. But by using calligraphy, write down whatever come to their mind, it's taken a mental shortcut to access to their experience. So for example, the clients will think about, for example, in the culture of a hierarchy, if the clients talk about their experience, let's say, family dynamic, it is difficult for them to say, I hate my mother, because culturally it's inappropriate. It's been, thousands of years of Confucius history about the hierarchy structure, the respect elderlies, and the different the parents and children, and then there's different, the hierarchy structure, it cannot be crossed. By using calligraphy, the clients could write a word like hate. And then the therapist could explore, what does that mean? So this then it started to unfold. And the client and able to keep their own calligraphy writing. So often I found is when the clients have found it's quite, the overwhelming feelings and thoughts can be quite contained, it's on a paper. The paper is that I use, it's about A3 size, depends on the setting, of course, and they could, and their clients could use multiple papers. And the similarity to talking therapy, this empathetic attunement, the client, the therapist is very familiar with the therapeutic process, and then understand the therapeutic relationship is a collaborative, and implicit, explicit communication. The therapist will noticing when the client writing the words, the force they use with holding the brush, and the stronger the words. So this will be all picked up. So this is the research object and hypothesis. So this that my doctorate is not directly address the effectiveness of the approach itself. Which I'm hoping in the future, in a larger study, I could to work on that. But it's more about to explain how their experience, how in response to CCET as a culturally sensitive therapeutic intervention. So this is the objectives and hypothesis. So I'll leave you to have a look at it. Okay. So my research, I use theory building case studies. In the doctorate, I use 2 case studies. I did a pilot study before, because the approach protocol was designed face-to-face, but it was in the middle of pandemic. So I did a pilot study to adjust the protocol, make sure it's okay to deliver online. in this study, I recruited 2 clients from Chinese community through poster ads and snowballing. And then 1 therapist from a very different area is a counseling psychologist who voluntarily to deliver the therapy. And the data from this study is from poster therapy interviews from clients and the therapist. And then the session transcription for each client have 4 sessions and the calligraphy samples. So the data of this study is a positive. And I hope in the future, I'm aware of the time, but I hope in the future I have an opportunity to go a bit deeper in terms of data. So I hope that there's a future study, and then there's some talk from in the UK about collaboration projects going on. So I hope to collaborate with more therapists and researchers who are interested in culturally sensitive approach. And I hope also get more fundings for research and implementation of support mental health issues in the minority communities, such as Chinese community. And this is some talk about for me to host workshop training as well. But I hope to update you guys in the future if there's opportunity. So this, that's all from me. This research is funded by UKCP Member Research Fund competition last year, and I'm very honored to win that competition. So that's me. Thank you so much, and I welcome questions.
Okay. Thank you very much, Jan. That was wonderful and really, really interesting and quite timely around in some of the conversations I've been having in my institution about making sure that access is equitable for different groups. Sarah, do you have your hand up, or are you clapping, or you're just clapping? Does anybody have a question? If not, I did have one that I wanted, well, sort of something I took out of your talk. So I'll just have a check in the chat.
Yeah. Judy,
if there's anything there at the moment. Yeah. So what I thought was really interesting was about how you.
Sorry, could I interrupt you, Wendy? Judy just raised her hand.
Oh, sorry, I didn't even see that. Sorry.
Sorry, I thought you'd given me the go ahead. Sorry.
No, sorry, no, that's me trying to do 5 things at once. Sorry.
Oh, no, it's just quick, really, just to say that was so interesting. I teach creative writing, and some of that links into therapy. And in that, we often do free writing, or like sort of an automatic writing, word association, doing it very fast, the opposite of what you're doing. I just would be interested to know whether you think you can get the same result with that opposite very, very fast, not thinking, letting it come out subconsciously, and how that might work then in this different kind of context.
Well, it's really interesting you mentioned about in education setting, and yeah, I suppose writing slow down processes are very important in therapy, because in slow down processes, like a bit like a sit in silence, is much harder, because talking, sometimes you talking something, you avoid the discomfort. Yeah, because couldn't stay with the silence. So slow down process in a way is allow the person to sink in. So from therapeutic approach, I would say for mindfulness, it's not about how fast you do, it's about be more pay attention to your experience. And in this case, it's like if you're grinding ink, it can be boring task, but it's very soothing. Yeah, if the client is very agitated, this is, if you ask them, how are you feeling today? They will say, oh, good. Yeah, but if they're grinding ink, it's processed unconsciously, they allow them to slow down. And does that make sense?
Yeah, no, I am going to try that. I'm so interested in what you've been talking about. I do use silence and meditation in conjunction with free writing. But when they do the free writing, it's very fast. So I'm thinking to combine the silence with just something really slow. I don't know how I'll slow them down, but tie their hands together or something.
Yeah, some people, some clients are writing much faster than others, and I think I'm very interested in that. So when they're writing very fast, generally speaking, the English speaking, the writing alphabet is quicker. Chinese characters are slower because the meaning is quite condensed. The character, the meanings behind is quite condensed. So that's, I mean, I hope in the future have opportunity to demonstrate the data I gathered and, go a bit more deeper. But I think it's even the writing very fast is a process. So they're beginning very fast and then they slow down because this process allows them to slow down. And this is in contradictory with life, is not allowed to slow down.
Fantastic. Thank you ever so much. I'm going to wrap that up now, just because if the more we go over, the later poor Vlad and I will still be here coming on the 10th. But that was so fantastic. And I really loved as well this real mix that came out of the sort of the materials forcing us slowing down because of the grinding, and the importance of the embodiment and that embodied empathy as well. It was just fantastic. Thank you so much, Jan, for that. That's wonderful.
Okay. That's okay. I hope I answered your question, Judy.
Judy, yeah, was that okay?
Is that okay, Judy?
It was brilliant. It was a fabulous, and I'm, my mind's full of ways I can reinterpret that. So thank you very much.
Okay,
Thank you very, very
you're
much.
more than welcome. Okay.
Next up.